Hello there. I'm here to introduce the Raphal Client Loyalty Reward Program, how to redeem your loyalty card, and all the benefits that comes with it. To redeem your loyalty card, spend 100 cedis or more at the Raphal Pharmacy Smart and get 3% discount on your first purchase right after you receive your loyalty card. It's that simple. With your loyalty card, you get a 5% discount on your 5th purchase and a whopping 10% discount on your 10th purchase. Whilst at this, you keep building your points to qualify for a free GP consultation with any doctor of your choice. It sounds too good to be true? Well, it is what it is. Spend 100 cedis or more now at the Raphal Pharmacy Smart and let's get started. Limited cards available. For further information, contact 0501 255 830 or 0509 542 987. Connect with us on Facebook, Instagram, Twitter at the Raphal Medical Centre. Raphal Medical Centre, the healer at work. We're still live here at Raphal Medical Centre. We're streaming live on YouTube at Raphal Medical Centre and on Facebook at Raphal Medical Centre. Do well to send your questions to our social media handles. We'll read them out for the speakers to do justice to them. In the meantime, you can send us SMS via 0501 255 830. That's 0501 255 830. And when I announce that you can call, that's the same number you would call. So just take note of the number. That's 0501 255 830. We'll go to Madam Charity Kwonu. Madam Charity Kwonu, I have this question. One is asking from social media, Facebook, that is it better to have a joint therapy with your partner to address past trauma? Okay, so it's a two-way question. Okay. If you are very open and honest to your partner, why not? Okay. You can decide to come because there's no secret in your life. So you just come and then the two of you have a session together. But if you know that there are certain things that you haven't opened up, they are exclusive to you alone, then at the sessions you can be separated. One will come and then with the permission of one, you let my husband in, let my wife in, but please don't talk about this. Then it means you have to manage the person as a therapist, but in the end, it will boost the marriage. Okay. But how can we share everything and then there are aspects where I come in to have a consultation with my wife and I'm supposed to excuse my wife and the doctor? Yes. It's true, but when it has to do with privacy and confidentiality, but amongst the two of you, you are one, but you are two different entities. Just like HIV, the doctor cannot disclose. Sure. Yeah, so there are certain things that privacy and respect must be accorded. Okay. If the two agree that they want to come, fine. But ideally, you deal with one, you deal with the other, and then if the two agree, you merge the two of them and you talk about the issue together. Fair enough. Yes. So question from social media. I want you to take that question. One is asking, how do women have sex confidently after childbirth?
Great question. I think it's a general misconception that after childbirth, the female genitalia is no more the same. I think that to have sex confidently after childbirth, one, you need to have a very open communication with your partner on your fears, if there's any anxiety that you have about sex, you want to communicate that with your partner. Then secondly, you want to gradually introduce sex, starting with non-penetrative sex to eventually penetrative sex. Then in order to strengthen the pelvic floor muscles and improve vaginal tone, you want to do some pelvic exercises, Kegel exercises. So you want to seek help, get professionals who are trained in pelvic floor muscle exercises to help with the exercises, and that will go a long way in strengthening the pelvic floor and also the vaginal tone. Then you also want to explore the possibility of using lubricants if there's pain and you think you are not lubricating enough during sex. You want to explore the possibility of using lubricants, and also some sex positions that will be comfortable for you, the woman during sex. So those are some of the things that we can do.
Sure. I'll announce my phone lines, and then I'll come back to ask you how long a woman must abstain right after childbirth. And then we'll talk about sex toys as we wrap up. So just in case you want to call in, you can call 0501-255-830 right away. Your call can come through the studio so you can ask your questions. That's 0501-255-830. You can as well send your questions via our social media handles on Facebook, Instagram, Twitter, now X. We would surely read them out, and our speakers are here. They will do justice to your question. We'll be wrapping up in no time, so if you have any questions, do well to send them in now. Doc, I was asking, how long will a woman have to stay away from sexual intercourse right after birth?
All right.
After delivery?
So I would not put a specific timeline to it, but the key here is that the woman must recover physically and emotionally. And so once the woman is able to recover physically and emotionally, then you can gradually introduce sex. But I will not say that 1 week or 2 weeks. If after 2 weeks the woman is not fully recovered, then you still want to wait for the woman to recover fully, physically and emotionally. So I will not put timeline on when a woman should have sex after childbirth. But the thing is that the woman should recover physically and emotionally.
Great. Okay, so it's about time we have this controversial conversation about sex toys. I want to know, there are people who believe that it's okay, it's normal to introduce sex toys in your sex life. I mean, I'm talking about couples here. It's okay to introduce sex toys in your sex life. There's this school of thought that also states that the very moment you introduce sex toys, when the man is away, the woman can be engaging the sex toy. And if the woman engages the sex toy for a long period of time, it also has an effect on her. Madam Charity, I know this is very controversial, but I just want to know, where do you stand on this? Introduction of sex toys or no sex toys introduction?
Kofi. Okay, so I have my personal stance. So I would say that ideally, it depends on the situation, but ideally, I mean, everything that the toy has is in your husband or is in your wife. So why don't you push your husband by gradually with love, patience, his hands, his head, his tongue, everything can be part of sex. So even if the organ is weak, there could be outer sex, there could be big time romance that can take place, or that can replace the sex toys. Sometimes some of the sex toys can carry infections if not handled well, and then also it can not give you the desire as you want naturally. So to me, I think that the best is the human being. So I'll utilize my husband, my wife to the fullest than a sex toy.
So emphatically, no room for sex toys.
Yeah.
Okay, Doc. You made mention when you were talking about the female sexual dysfunctions. You made mention that there are cases where a lady could have delayed orgasm. In this case, do you think introduction of sex toys will be the best way to go about someone who has delayed orgasm?
Okay, so as part of treatment of delayed orgasm, sex toys is not necessarily a solution.
Okay.
So as I mentioned earlier, you want to know what the cause of the delayed orgasm is, and then you are able to adequately deal with it. So we cannot propose that sex toys, because of their nature, are able to solve someone's delayed orgasm. So sex toys, I won't say that they are a panacea to a delayed orgasm.
Okay, so you're also stating emphatically that no room for sex toys.
All right, so sex toys if you want my personal opinion.
Sure, I want your personal opinion now. Aside the medical bit, I want your
personally, I also know I will not go for sex toys. I will not go
Any
for sex
reasons?
toys. Okay, so for instance, it could come with infections. People could be allergic to sex toys.
Okay.
Yes, and I think that if sexual education is carried out well, and men and women understand their anatomy and their physiology, how their bodies work, they should be able to enjoy sex without the use of sex toys.
Okay. Okay, sure. I have another question for you. One is asking, can any sex position or posture lead to stroke development, especially for the man? I would come back to you so you answer that question, Dr. Kwashi. But in the meantime, you can call in 0501 255 830. We have less than 10 minutes to wrap up, so if you are tuned in and you have any question whatsoever, aside the social media questions, you can call in right now on 0501 255 830. Doc, someone is asking about sex positions and posture. If there are any sex position or postures that can lead to stroke development, especially for the man.
All right, so coming through literature, you wouldn't find a lot of articles on sex being a cause of stroke.
Okay.
Yes, so I wouldn't say that one particular sex position or the other could lead to stroke. I will not say that. So coming to literature, no, sex is not a cause for stroke. Even though
the posture, there's no sexual posture that could cause that. Because over the years, people have victimized, I mean, we can say everything today, people have victimized the doggy style a lot. So I'm sure this question is coming from that angle. People just want the clarity.
Yeah, so if you look at the causes of stroke, you will not see sex position as one of the causes of stroke. Conditions. It could be the person could have diabetes, hypertension, hyperlipidemia. So all those are underlying conditions that could then
okay. So if I get what you are saying, it wouldn't be solely based on the posture.
No.
You would have to, be someone with those underlying conditions before you can have stroke. That's okay. We have another question here from social media. You can still call. Our phone lines are open. You can call 0501 255 830. 0501 255 830. We have another question from social media. The person is asking, are all sexually transmitted diseases imported into marriage? In other words, if a couple are faithful partners, can there still be a sexually transmitted disease? Let me take that again. Are all sexually transmitted diseases imported into marriage? In other words, if a couple are faithful partners, can there still be a sexually transmitted disease?
So that's another good question. So sexually transmitted infections are transmitted, meaning that it comes from someone who has the infection to someone who doesn't have the infection. So if you have two people, two sexual partners who are mutually faithful, and none of them is carrying a sexually transmitted infection, then you don't expect them to develop a sexually transmitted infection. So for instance, if you have two people who are mutually faithful to each other, they don't have HIV, you don't expect that HIV all of a sudden will spring up in that union. Sure. Unless it's acquired through another means.
Doc, sorry to cut you. We have our caller on the line now. Hello, good morning. Your name and where you are calling from?
Hi, my name is Esther, calling from Tema. Yeah, can you hear me?
Good morning. I can barely hear you. I don't know if you can speak up, caller.
Is
Madam Esther. Madam Esther, can you hear me?
I can hear you.
Madam Esther, can you hear me? I think our resource personnel in the studio are not hearing Madam Esther. The technical team would have to try again so we can get the question and then answer appropriately. In the meantime, you can still call 0501-255-830 just in case you joined us. This is Raphal Medical Centre's pre-vals day event focused on sex education and sexual dysfunction. Just know that this show is made possible by the management of Raphal Medical Centre, and it is powered by our respective wellness packages. We have the premarital wellness package, just in case you have plans to get married, you and your partner can walk in, so we run the respective labs for you at a discounted price. And then also, if you have any aged home, being it your mom, your dad, you can always come in and ask about our comprehensive men and women wellness packages. These are all subsidized packages meant to help you. We thank you for joining us. We super appreciate your time. That's why we are giving you all these packages at a discounted price. We will surely wait for our caller so we can just get the question for our resource persons to answer the question. So Doc, you were talking about that there's no chance sexually transmitted disease can just pop up from nowhere, especially when the couples know themselves. They've done all the needed tests and no one has any sexually transmitted disease. As far as they stay faithful, there's no way anyone can catch any sexually transmitted disease from nowhere.
Yes, so for instance, if you take HIV, apart from sex,
okay,
there are other modes of transmission. Okay, so if they are mutually faithful sexually, then you don't expect that HIV, which is not in the union, will be transmitted through sex.
Okay.
But if someone, for instance, gets a blood transfusion that's contaminated, for instance, in that union, then that could be a point where HIV can be introduced into that union. But through sexual means, where both are mutually faithful and they are both negative, then you don't expect that transmission to happen.
Okay, that's great. Doc, Madam Charity, let me just ask you, what are some of the common challenges faced by aging individuals in maintaining sexual health, and how can they adapt to these changes? Like we keep saying, the world keep evolving, and I mean, there are changes that we encounter at every point in our life. Yeah. So we just want to have a fair idea of these challenges based on your experience and your practice, and how we can adapt to these changes. You can still call 0501-255-830. Before we wrap up, you can as well send an SMS. You can send your question via SMS, and then we surely read it out for you.
Yeah. So aging, of course, we know, can affect a lot of things. Vital organs begin to lose their strength and power, and then sometimes the nervous system goes through challenges. Blood vessels becomes thinned or becomes blocked, and sometimes the muscles become flaccid and weak. In fact, I don't know whether Doc will bear me out, but I was told that even the penis, the male organ, when you are growing, it becomes smaller. It shrinks.
That's true.
Yeah. And then the vagina also becomes more drier. So you can imagine, it comes with challenges. So from 50 and above, you should get ready to experience these things, erectile dysfunction and women not having their orgasm. And sometimes to life adjustments, going through retirement, and then looking back, you didn't plan your life well. Now you are full of regrets. All these things can have. Yes, yes. And then you look at it and you realize that, in fact, you have regretted a lot of things in life. So what we have to do is that work around your emotions. I mean, it's never too late. You should appreciate that you are aging and these challenges are bound to happen. Try and then make yourself happy. I mean, exercise, eat well, and then the little that you go through, if you should have sex and you are able to do a little bit, Doc was mentioning 50 seconds, maybe you 1 second and you couldn't do much. I mean, appreciate your partner, should appreciate you, should encourage you, and then you can try other positions little by little, and then eat well, exercise well, and then make sex, you shouldn't make sex the priority. It could be outer sex, you could engage yourself in other ways of sexual habitations, which is not real inter. And, you know, manage yourself through. And I'm sure that when things are settled and optimum in you, age will not be the factor. You still enjoy the wife of your youth.
All right, Doc, let me take your view on this.
All right, so if you look at literature, for instance, erectile dysfunction in men less than 40 years, it's about 1 to 9%. But after 40 years, it could go as high as 30% of men having erectile dysfunction. And the peak age for sexual dysfunction in women is 51 to 59 years. So that tells us that as you age, our bodies go through some changes. For instance, the female reproductive system becomes a bit more drier and atrophied. So
Question is, how can the use of sex toys enhance intimacy between partners?
Okay, your name again, please. Okay, Madam Esther, thank you for calling in. Our speakers will do justice to your question. But there's this question from social media which got me laughing, but I would have to ask anyway. Doc, someone is asking if it is okay to have sex every day. I don't know how the person is going to do that, but then we still need to answer the person anyway. Is it okay to have sex every day?
all right, so I think that there is no limitation how many times you can have sex or how often you can have sex, but your body will be able to determine that. So if you are physically healthy, both parties, both partners, you are someone who exercises regularly, that may be possible. But if not, then you want to recover after sex. So you give yourself maybe a day or two to recover before you go in for another round of sex. But if you are someone who is very physically active, very healthy, you check yourself regularly, I don't think there's any limit to whether you should have sex once a day or once every other day.
Okay, so whoever asked that question, I'm sure you have your answer. I don't know how you're going to do that. Have sex every day, even when you go to work, you take breaks. So please, just take a break. We have another question here I want to ask. One is asking, what about sex toys for women whose husbands impotent or whose husbands are impotent or can't sustain an erection? Back to the sex toys conversation. Those whose husbands are impotent or can't even get an erection.
I think a lot of people are excited about the issue of sex toys. But I think that when it comes to sexual dysfunction, there are various solutions, from medical solutions all the way through to surgical solutions, where you could actually have implants, penile implants, that will help the man get an erection. So the management of sexual dysfunction, dysfunction you have, you should be able to get a solution to it.
Okay.
Yes.
So if I get you, sex toys wouldn't be the actual
solution. So sex toys will not be the solution
medical
in this scenario.
Okay.
It's better the couple seek medical advice, and you may never know. It could just be something very simple that even a medication could solve.
Okay.
Not even necessarily going for implant, just a medication may solve that. So seek medical advice, and once you seek medical advice, what the appropriate treatment is, you get it. Okay,
so don't resort to sex toys immediately. Please do well to seek medical advice first. Let's go to the question our caller Esther asked. Esther asked, in what ways do our cultural attitudes towards sex influence the availability and acceptance of sex toys here in Ghana? Still on sex toys. Let me take that again. In what ways do our cultural attitudes towards sex influence the availability and acceptance of sex toys here in Ghana?
Okay, thank you, Esther. So we just have to know that in Ghana, our culture and norms of sexual relations are something that we hardly talk about, but we can never underestimate it. We want to advise the youth that if you are not married, try and zip your trousers. We want to
please
advise.
Look into the camera and see that one.
We want to speak to the youth of Ghana that if you are not married, do well to zip your trousers and keep your panties on. I mean, katasune si. That's why they call it chain, so that you chain when it's right, then you open it up. So we want to encourage chastity and faithfulness. And of course, in our culture, we hardly talk about sex, but now it's everywhere. I mean, social media, technology, people are going global when it has to do with sex. With sex toys, all that we want to say is that we want to encourage openness and honesty about sexual behaviors. If you are going through a challenge, open up and seek appropriate help. Sometimes it's just a little stress that is bringing the sexual dysfunction. Why don't you see the psychologist, see the medical doctor to help you? If you come to Raphal, they will help you. Sometimes it will even come from an STI that is hidden somewhere. And one medication, and then you are good to go. Stop buying medicines, buying anything in the car that you are going to take, and then you end up with kidney infections, ending up at Kolebu and what have you. So we want to encourage that. Open up. Be honest about your challenge. Don't use sex toys to cover up what is actually eating you up. And then seek for appropriate help. There are so many numerous problems that can be attributed to sexuality. So go and seek for help. But the use of sex toys will cover up what is actually leading to that problem, and then it will not help. So we want to say that don't let technology and other things just push you. You just go and buy the vibrators and what have you. Seek help. And sometimes even through the help, they can advise sex toys if it's very necessary. Okay. But I think it shouldn't always be intercourse. Outer course is also part of sex. And in outer course, everywhere, as I mentioned, can speak to it, and it will do well.
Good.
Thank you.
It's still on sex toys, though. And second question, how can the use of sex toys enhance intimacy between partners? That's her second question.
Of course, that will be quite difficult because it serves between you and the partner. Once it becomes secondary, connecting your husband through a sex toy is something of psychological. You either minimize your husband to the state of that sex toy, or you maximize the sex toy to the state of your husband. And that is a cognitive bias. It's quite negative to reduce your husband to the level of a sex toy and to raise your husband to the to the sex toy to the aspect of your husband. We call that either minimization or magnification. Once you go through that, it's a cognitive bias. So what we want to say is that your husband is your husband. Have him as your husband. Respect him as your husband. Don't reduce your wife to a sex toy. Manage him as a human. Explore him. And then make him your adorable husband and wife. And in any little way, I'm sure sex will be great. Even if it is minimal, you will enjoy it. It's all about your brain, your mindset, your emotions, and how you respond to the sexual advances and experiences. It's good to go.
Okay, thank you. Thank you so much. We have this question, Doc, it will come to you. I know you might have mentioned it earlier, but probably the viewer joined late. The viewer is asking, what are some common causes of erectile dysfunction in men? What are some common causes of erectile dysfunction in men? And what steps can be taken to address or manage it?
All right, so common causes of erectile dysfunction in men. We'll look at vasculogenic causes such as hypertension, coronary artery disease, peripheral vascular disease. We'll look at endocrine causes such as diabetes mellitus. We'll also look at thyroid disorders, hyperprolactinemia. We'll look at hyperlipidemias as well. We'll look at neurogenic causes such as peripheral neuropathy, spinal cord injuries, strokes, can all cause sexual dysfunction. Medications such as antihypertensives, for instance, beta blockers, methyl dopa could also cause erectile dysfunction. Then the use of substances could also cause, and alcohol could also cause erectile dysfunction. How can this be addressed? Some general principles, lifestyle modification. So you want to improve your exercise, you want to lose your weight so your BMI is within the normal range, you want to improve your diet, those are avoid substance abuse, minimize alcohol, so those are general principles, and then the specific cause will then determine the solution. Then also, there are some, as I mentioned, some medications that can be given for erectile dysfunction. Phosphodiesterase 5 inhibitors, for instance, can be used. We could use implants for erectile dysfunction. We could use intracavernosal injections for erectile dysfunction. So there are so many remedies for erectile dysfunction, depending on the severity and then the cause.
Okay, I mean, our phone is buzzing with a lot of questions now.
So but I wanted to add on a little to Doc's submission. Just to add on is that masturbation, some of the youth are indulging themselves too much into it. I had a client who could do as many as 27 times in a day. So he's become something else. So masturbation, watching the pornographic stuff, you see, porn, and those things and then buying medications. People want power, manpower, something to make your penis big and, to stand erection for a whole day and what have you. We want to advise the youth that seek help from appropriate quarters like Raphal. Don't go around buying anything, taking anything for manpower, black power. It could be deadly.
Okay, thank you so much for this. But Doc, I just want to ask you, manpower, something to make it big. Is there anything like that to make it big? Or it's just delusional?
Interesting. So, something to make it big. In this technological age where there is so much advancement in science, where we have a lot of organ enhancements, you want to seek appropriate care. You want to seek appropriate care if you want to enhance an organ and not go over the counter or into the public space and just buy anything to use.
Okay, we have a lot of messages, so let me just take them and then we try and wrap up. This person says, please, myself and my wife recently got married and are all first-timers, hence we find it difficult to penetrate. Initially, I didn't know the way, but after discovering it, my wife often complained of pain. Please, we need your help, for we haven't enjoyed sex yet in our marital home.
Oh, God.
And that's from social media.
Yeah, it's...
Okay, so this, in fact, I had a couple some time back, and they had a similar challenge. So they were both new to the act, got married, and a week after marriage, then the husband called that we are unable to have sex. What should we do? So then I asked about sex during the premarital counseling. And the man said, oh, they were told that once they get to the bedroom, they'll be able to find their way. So I think that premarital counseling should have some component that is dedicated to sex and sex education.
Yeah.
Now, especially because the man must understand the female anatomy.
Sure.
Okay.
Even the woman must understand her own anatomy. There was an instance where the man was trying to penetrate the lady via the urethral meatus, where the urine comes from.
Okay.
Instead of the vaginal orifice. So if you don't understand the female anatomy, you would want to penetrate where you shouldn't. So for this particular couple, for them to have a very good sex, there must be good lubrication. So the excitement stage, that foreplay stage, must be a bit well done. They must know the various erogenous zones, as my sister Charity mentioned earlier. The 8 erogenous zones, and must be able to use them properly. So the mouth, the neck, the nipples, the areola, the ears, the clitoris, the vagina, they must be able to use the erogenous zones correctly. Once they're able to do that, that will stimulate the woman properly and prepare the woman for insertional or penetrative sex. So those are some of the things that they can do to improve their sexual experience.
Okay, Doc. I think we would have to do a part 2 of this some other time, because you're talking about all this. I'm tempted to ask whether sex before marriage could be a solution, but we'll leave that for another topic. Let me just read this one also from social media. The person, is it true that men need to have sex 21 times in a month so as to avoid prostate cancer? I think that's what the person is trying to ask, that if it is true that men need to have sex 21 times in a month, how many days do we have in a month so as to avoid prostate cancer? Doc, you can take that.
All right, so there are a lot of myths and misconceptions all over the place.
Sure.
So there's no literature that says that once you have sex 21 times a month, you would avoid prostate cancer.
Okay, and then this one, is it true that much sex can help reduce or prevent build emotional intimacy? What kind of exercises can couples do to enhance this? I know we've mentioned...
Yes, emotional intimacy.
Already mentioned this. This person is asking, how can women who are struggling with expressing their feelings about sex have good sex? How can we ensure that men listen to women during sex? I think let me take that again so you can say something briefly on that. The person is asking, how can women who are struggling with expressing their feelings about sex have good sex? How can we ensure that men listen to women during sex?
Okay, so we want to encourage all women that please, that time that we will not talk about sex is past. Just encourage yourself and know that it's a need in your relationship. You need sex to be part of your relationship. So talk about it in little, small steps. Don't start boom. Your husband will be shocked at you. But just start little by little. Talk about it. Build it on emotional language. It could even be touches. It could be approaches to the love handles. In all ways, you could talk about the sex. It's not straight talking about the organs, but anything to do with sexuality. Just start in little bits. Push yourself up. Encourage yourself. Men, we know that men are mostly a little bit poor at listening, because men usually, they like moving and doing things that are bulky. But please, have ears for your wife. Okay. Listen to your wife's emotions and, get connected to your wife and help your wife through whatever she's going through. Give her all the needed attention. And when she's talking, wait, listen, stop, paraphrase, and be connected to your wife. We are pleading with men to give room to the women. But sister, if your husband is not minding you, go and stand in front of the mirror, talk to yourself, put some videos in your ears, listen to music, and happy yourself. It's not always your husband. It should come from yourself.
Great.
Thank you.
Doc, let me ask you the same question. The person is asking, how can women who are struggling with expressing their feelings about sex have good sex? How can we ensure that men listen to women during sex? That's
all right, Kofi, thank you very much. But just to make a quick comment before I come to this substantive question. The question on whether when you have sex 21 times in a month, you prevent prostate cancer. Yeah, so 21 times in a month, no. There is no concrete literature that says when you have 21 times in a month.
But is there any particular
But then, there is some evidence, not fully concrete, but some evidence that if you have frequent ejaculations, there is that potential reduced risk of prostate cancer.
Doc, take that line again.
So,
I think my men will like that, so please take it again.
So there is some evidence.
Some evidence.
Further research is still ongoing that when you have frequent ejaculations, there's that likelihood that you have reduced risk of prostate cancer.
Okay.
But not 21 times in a month. That's what I want to clarify.
Okay. Okay. And there was this question, though we answered, but this person has put it in context. How can couples build emotional intimacy? What kind of exercises can couples do to enhance this? The person is asking, if your partner is abusive, how then do you build emotional intimacy?
Yeah, it's difficult.
Yes.
Yeah, if your husband is abusive, then it's quite difficult. As Doc mentioned, let's see the roots to the problem. So this intimacy issue, emotional intimacy, is because there is an abuse. So the abuse must be corrected. But what do? Address the abuse. Talk to your husband, conflict resolution, empathic listening. Put yourself into your husband's shoes or your wife's shoes. Listen to her compassionately. Paraphrase whatever she's saying. Let's put in efforts to solve the problem. I mean, certain things must be done right to help ameliorate the pain the woman is going through. When we do things right, the emotions and the pains will just dissolve, and then you have a great sex.
Okay. So let me ask my last batch of questions. This person is asking, is sex addiction possible? How can people address sex addiction? And how can sex addiction be treated? Is it possible?
Yeah.
How can people address it, and how can it be treated?
Yeah, it's a behavior, and most behaviors...
Is it possible?
Yes. People are addicted to sex. Someone will ask me, Didi answer na maye, and I mean answer na maye, answer that thing. So it means that sex has been minimized to food. So every day we eat 3 times. So it means you must be ready. There are some people who are addicted. It depends on where the person is coming from, the experiences of the person, and what is bringing about this addiction. Addiction, always we have to do. It's a behavior from the mindset to the emotions. Things are not balanced. Once it's become an addictive, then it is not pleasant. It's not lovely. You are punishing your partner who has to go through these things every day with you. You need help. So quickly seek for psychological help to help you correct these defects. It can't be.
Okay, Doc, can it be treated? Sex addiction.
So, just as any addiction can be treated, sex addiction can also be treated. And I will gladly refer you to the clinical psychologist to help you manage any addiction, including sex addiction.
Okay. Doc, someone is asking, you spoke about lubricants. Someone is asking if, I don't know if you'd want to answer that. Someone is asking if you would recommend a particular brand, any lubricant.
All right. So typically, I will not recommend a particular brand, but you can get water-based lubricants. That should help. If you think that the issue you're having has to do with lubrication, but I will not recommend any particular brand.
Okay, someone is asking if there are any do's and don'ts for couples in having good sex. Any do's and don'ts for couples in having good sex?
I think we've spoken a lot about what people should do in having good sex. Open communication is very important. During the excitement phase, you want to have very good foreplay. That will also go a long way to improve the sex experience. Then lifestyle-wise, you want to be a healthy individual to enjoy sex. So your exercise, your dieting should be good. You should avoid substance abuse. You should also minimize alcohol intake as much as possible. Always get checked. Get onto one of the wellness packages for men or women and get checked. And you should be able to enjoy your sex life.
Okay, Doc, someone is asking if we can throw more light on creating or having sexual habitation, as you mentioned. Someone wants a bit more light thrown on that, creating or having sexual habitation. Okay,
so creating a sexual habitation has to do with yourself. You know, the couple must come together to know what sex is all about, where they have to meet or agree on where they have to involve in the sex, and then also making it as pleasant as ever, making sure that STIs and other infections are checked so that you can't doubt your husband or your wife. Faithfulness must play a part, reducing stresses, and then also making sure that you are not having side chicks. You are faithful to your wife and your husband, and then making the sex a personal choice that the two of you have agreed that this is what we are going to do and feel comfortable in doing it. And even if you have to go for family planning so that you don't have sex in fear of getting pregnant, and making the sex very pleasant and good, and not making the sex as an activity that everybody should watch. It should be private in your room, so children will not be seeing you, making it so open. And then also putting in things in place to make it pleasant. So when we put all these things in place and we try and spice up our sex and make it habitable, I think we'll enjoy it and it will be great fun for us.
Okay, so this is my last but two questions. Someone is asking if there can be rape in marriage, and then also what do you do if the sex is continually bad? Continuously, if the sex is bad, what do you do, and whether there can be rape in marriage?
So if the sex is continually bad, I would advise you seek care. Seek help medically and seek help from a clinical psychologist. If the sex is continually bad, please seek help. Okay. Of course, rape can happen anytime, whether in marriage or outside marriage, there can be rape.
Okay, yeah. And someone is actually asking how you can escape from an abusive partner who wants sex.
Yeah, abusive partner who wants sex. Escaping from that person to where? Where are you running to?
I mean, if your husband is trying to be abusive and rape you.
Yes. You can't run away. At that particular time, maybe you have to exercise patience and let him have it peacefully with you instead of the rape. But after that, solve the problem. Don't just sit down and keep going through these molestations. You end up dying. So we are pleading, seek for help. Come see the psychologist, the counselor, and try to talk to your husband to also seek help. It's not you alone. He also needs help because the problem is coming from him. When they meet him, they can help him. Maybe it's outside him. They can help him come out. But saying that you are running away means that you face the problem one day. Let's solve it.
Okay.
Yeah.
Okay. Our very last question. You know, the questions keeps coming, but we need to wrap up. Our very last question. One is asking how do couples maneuver conflict around sex.
Okay. Conflict around sex is part of conflict resolution.
Sure.
When the activity is about to come on, that's not the time to talk about the conflict resolution. You see, the man is on heat, and you are not saying that Nasenayan cancer. It won't help. So please enjoy your sex, And after that, sit down amicably at dawn, in the morning, in a chat, in the car, you are cooking, your husband comes around. See some space, the time you see him happy, and you talk about the issue. Try and swing to the bedroom. If the issue happened in the kitchen, settle it in the kitchen. In the hall, settle it in the hall. Why do you carry the whole clutter of the day to the bedroom? You can't solve those problems in the bedroom. Seek the appropriate quarters, see the appropriate vulnerabilities, and then speak to the issue. Solve all conflicts. Do your best to minimize the conflicts, and then go to the bedroom with a free mind. But even if the problem is not solved, don't carry issues to the bedroom. Do your best to solve the problem at the appropriate place and quarters.
Great. So we are about wrapping up. Doc, that's your camera. What are your last words?
All right. So I would say that sexual dysfunctions are common. They are treatable. And so I will encourage all couples to pass through if they have issues with sex and sexual dysfunctions, and we'll be glad to assist in solving their issues. I will also, at this point, want to say that we want to introduce to women in the reproductive age what we call the Talk to Your Midwife program, which will be starting on the 8th of March.
Talk to Your Midwife program.
Yes.
By Raphal Medical Centre.
By Raphal Medical Centre.
Starting
on the 8th of March.
8th March.
Where very charismatic midwives will be available online to interact with our women and also men, couples, about conception, pregnancy, and pregnancy-related issues. And we are sure that this will go a long way in helping our women and our couples solve some of their pregnancy-related issues and conception issues. So my last words, sex and sexual dysfunctions can be treated. Seek help.
Thank you. Madam Charity Kuono, your last words, please.
Thank you. I think it's an honor being on this panel. It's been nice talking to Dr. Kwashi Kofi, and we want to appreciate Raphal Medical Centre for promoting this big platform of educating and information. We are grateful. Yeah, so what I want to say is that sex education should not be limited to only adults. I want to say that sexual communication is key. So open up. Sex is a consensus between a partner and a wife. So if it is so, why do you have to have secrets in your relationship? Honesty, kindness, openness, love, faithfulness, chastity are all vital parts of sex communication. Let's try and speak to issues. Let's diverge to diverge, and then in the end, let's come together in a consensus, build better homes so that we can bring up children that will also manage their lives well. Then in the end, the whole group and Ghana will be beautiful because our sexual relationships are regulated and coming up in the best way. We wish you well in this Valentine's season and hope you enjoy great sex with your wife, with your husband. God bless you.
Look, I did mention that we are not taking any more questions, but I mean, for them joining us tonight, I just want to ask the very last question. One person is asking what you would do if your partner does not give you sex often, and if you complain that your partner says you love sex too much, what would you do?
That's an interesting one. So I think that it all boils down to open communication between the couple, so that you are able to discuss freely and frankly what you expect of your partner and what your partner also expects from you. And also, I think that if the sex itself is enjoyable enough to the other partner, the person may increase the person's availability for the sex may be better. But if the sex itself is not pleasurable and is painful, then the person may avoid sex. So it's one of the sexual dysfunctions, sexual aversion disorder, where people avoid it because of pain, or because they are not enjoying it. So again, I would say that this couple can take help and see how best to help them. On this note, I also want to wish everybody a happy Valentine's Day. We should celebrate Valentine's Day quickly. At least get your partner a bag of chocolates. That will go a long way.
Okay. Thank you all for joining us. I've actually had a great time. I have a lot of takeaways, and I know you definitely have a lot of takeaways too, especially with the kitchen kunchai things. I know my have taken. Happy Vows Day in advance to everyone. Go out there, show love, and all that you've learned today, please don't let it be in vain. Put it into practice. And if you need medical help, if you need psychological help, Raphal Medical Centre is always here for you. My name is Kofi Annan. I was your host, and I was joined in studio by clinical psychologist Madam Charity Kuono and medical director for Raphal Medical Centre in the person of Dr. Michael Kwashi. I personally promise you a part 2 of this segment because I know you will love it. Stay tuned into Raphal Medical Centre. Thank you for joining us. Enjoy the rest of your day.
Hello there, I'm here to introduce the Raphal Clients Loyalty Reward Program, how to redeem your loyalty card and all the benefits that comes with it. To redeem your loyalty card, spend 100 cedis or more at the Raphal Pharmacy Smart and get 3% discount on your first purchase right after you receive your loyalty card. It's that simple. With your loyalty card, you get a 5% discount on your 5th purchase and a whopping 10% discount on your 10th purchase. Whilst at this, you keep building your points to qualify for a free GP consultation with any doctor of your choice. It sounds too good to be true? Well, it is what it is. Spend 100 cedis or more now at the Raphal Pharmacy Smart and let's get started. Limited cards available. For further information, contact 0501 255 830 or 0509 542 987. Connect with us on Facebook, Instagram, Twitter at Raphal Medical Centre. Raphal Medical Centre, the healer at work. Hello there, I'm here to introduce the Raphal Clients Loyalty Reward Program, how to redeem your loyalty card and all the benefits that comes with it. To redeem your loyalty card, spend 100 cedis or more at the Raphal Pharmacy Smart and get 3% discount on your first purchase right after you receive your loyalty card. It's that simple. With your loyalty card, you get a 5% discount on your 5th purchase and a whopping 10% discount on your 10th purchase. Whilst at this, you keep building your points to qualify for a free GP consultation with any doctor of your choice. It sounds too good to be true. Well, it is what it is. Spend 100 cedis or more now at the Raphal Pharmacy Smart and let's get started. Limited cards available. For further information, contact 0501 255 830 or 0509 542 987. Connect with us on Facebook, Instagram, Twitter at Raphal Medical Centre. Raphal Medical Centre, the healer at work.